What's the difference between panic attacks, anxiety attacks, and panic disorder? Are you ever in a situation where you are overcome by a profound sense of dread, almost as if a dreadful event is about to take place? You could be wondering whether you are experiencing a panic attack or an anxiety attack. Perhaps you had even heard the phrase panic disorder and thought that it would be applicable to the sensations that you have been having. In spite of the fact that these names are frequently used interchangeably, they refer to separate phenomena that each have their own set of symptoms and effects. The question now is, what exactly is the distinction between panic attacks, anxiety attacks, and panic disorder? Uncovering the complexities that lie beneath each of these experiences requires that we go deeply into them. What is a panic attack? Imagine the following. You are going about your day as you normally would when, out of the blue, you feel your heart pounding, your chest tightening, and an overwhelming sense of dread sweeps over you. You may also have feelings of dizziness, shortness of breath, or a sense that you are losing control. Panic attacks are incidents that occur suddenly and are referred to by psychologists as panic attacks. An immediate severe burst of terror or discomfort that often reaches its height within minutes is what physicians refer to as a panic attack. Many patients, due to the severity of the condition, misdiagnose their symptoms as being those of a heart attack or another type of medical emergency. Attacks of panic are frequently unpredictable. They can occur without prior warning and in some cases without any visible stimulus acting as a catalyst. Your body goes into a condition of fight or flight mode when you are experiencing a panic attack. This means that it releases a surge of adrenaline in order to get ready for what it perceives to be a serious threat. Your body is reacting as if you are in immediate danger, even if there is no actual threat present. The symptoms are not just occurring in your head, they are occurring in addition. This rush of adrenaline causes a variety of physical symptoms, including chest pain, a rapid heartbeat, perspiration, shaking, and an overpowering desire to flee the situation. Have you ever pondered the specific reasons behind these attacks that appear to come out of nowhere without warning? According to research, they can be brought on by a variety of factors, including stress, particular life events, or even hereditary predisposition. On the other hand, when they occur for no apparent reason, it can be both perplexing and alarming. How are panic attacks different from anxiety attacks? In light of the fact that panic attacks are characterized by their suddenness and intensity, you might be wondering, what is the difference between a panic attack and an anxiety attack? Isn't it the same thing that they are? There are some parallels between the two, but the most important distinction is in the timing and the reason for each. Although anxiety attacks are not officially recognized by professional standards in the same way that panic attacks are, the phrase is commonly used to describe extreme episodes of anxiety. Anxiety attacks, on the other hand, typically develop gradually in reaction to a stressful circumstance or thought, in contrast to panic attacks, which can occur suddenly and without any prior warning. Do you ever find that you are experiencing a great deal of anxiety in the days leading up to a significant test, job interview, or other major event? There is a possibility that the anxiety will escalate, making it difficult to concentrate or relax. Anxiety attacks are often associated with a particular stressor, and although their symptoms are comparable to those of panic attacks, they are typically far less severe. It is possible that you will suffer physical symptoms such as muscle tension, a racing heart, dizziness, or difficulty sleeping during an anxiety attack. You may also feel tense, anxious, or overwhelmed during an anxiety situation. The intensity of these symptoms, on the other hand, does not typically reach its climax as abruptly or as severely as it does during a panic attack. Panic attacks are characterized by a sudden and severe onset, although they typically pass after a short period of time. On the other hand, anxiety tends to be more chronic and long-lasting. Is it possible for you to relate to these emotions? If such is the case, gaining an awareness of the factors that bring on your anxiety could assist you in better managing these attacks. The hidden struggle of panic disorder. In order to take this a step further, let's consider what occurs when panic attacks are not merely a one-time occurrence, but rather a persistent problem. At this point, panic disorder plays a role in the situation. People who suffer from panic disorder are suffering from a form of anxiety condition in which they experience panic attacks that come on suddenly and repeatedly and live in constant terror of having another one. It is not only the panic attacks themselves that are incapacitating. An additional factor that contributes to this is the continual worry about when the next one might occur. Because of this dread, people may find it difficult to carry out their everyday activities. They may avoid particular circumstances, places, or even people because they believe that these things could be potential triggers for future attacks. What would it be like to be so terrified of having another panic attack that you avoid driving, going to areas where there are a lot of people, or even leaving your house altogether? In those who suffer from panic disorder, the fear of anxiety itself can easily become overwhelming. It is possible that they live with a persistent feeling of dread and are continually on edge, and this vicious cycle of concern frequently results in the occurrence of additional panic attacks. Does this sound like something you've heard before or someone you know? Untreated panic disorder can have a significant negative influence on a person's quality of life, reducing the opportunities available in both their personal and professional lives. But why do these attacks happen? It is one of the most aggravating aspects of panic and anxiety attacks because they frequently give the impression that they are beyond our ability to control. It is not clear why some persons are subjected to these attacks while others are not. Despite the fact that precise origin is still unknown, professionals in the field of mental health feel that it is most likely a combination of environmental influences, brain chemistry, and hereditary influence. Have you ever imagined that the history of your family might have something to do with the anxiety that you experience? Research has demonstrated that panic disorder can be inherited, indicating that there may be a connection between the two. In a similar vein, an imbalance in neurotransmitters, which are chemicals in the brain that govern mood, may make certain individuals more prone to anxiety and panic episodes. It is important to note that life experiences, in addition to genetics, play a significant effect. There are a number of factors that can raise the probability of getting panic disorder or having frequent anxiety episodes. These factors include traumatic experiences, big life upheavals, and persistent stress. Some of the factors that could be contributing to the increased anxiety that you are experiencing could include the fact that you have recently been through a tough phase in your life. Strategies for overcoming anxiety and panic. Therefore, what are some ways that these overpowering experiences might be addressed? One piece of encouraging information is that panic attacks, anxiety attacks, and panic disorder are all disorders that may be treated. However, it is essential to look for the appropriate form of assistance. Both anxiety and panic attacks can be effectively managed by therapy, particularly cognitive behavioral therapy, CBT, which is particularly successful in this regard. Individuals are able to gain a better understanding of the beliefs and actions that are responsible for these attacks, and they are also taught effective coping techniques through this therapy. In addition to psychotherapy, many people find comfort through the use of medicine. This is especially true for those who suffer from panic disorder, where antidepressants or anti-anxiety pills can assist in regulating the chemical composition of the brain and reducing the number of attacks that occur. Alterations to one's lifestyle, such as engaging in regular physical activity, practicing mindfulness, learning breathing techniques, and maintaining a nutritious diet, can also help reduce overall levels of anxiety. When you are experiencing a moment of panic or anxiety, have you tried doing breathing exercises? You can bring your thoughts back to the present moment and lessen the intensity of an attack by practicing grounding skills. Some examples of grounding techniques include focusing on your surroundings or counting your breaths. The breaking of the cycle. Feeling as though you are stuck in a never-ending loop of fear and concern can be a common experience for people who live with panic attacks, anxiety attacks, or panic disorder. It is crucial, however, to keep in mind that you are not alone and that assistance is accessible to you. You'll be able to take the first step toward understanding your symptoms and finding the treatment that is most effective for you if you are able to recognize the differences between these experiences. If you want to take control of your anxiety, today might be the day you do it. It is possible to break free from the cycle of fear, and this can be accomplished by approaches such as therapy, changes in lifestyle, or just seeking out for help. It is not necessary for you to be defined by your panic and anxiety. The route to mental well-being and peace of mind can begin right now. After taking some time to think about your own experiences, what actions are you prepared to take in order to reclaim control of your life? The first step toward a more peaceful and healthy future is to have an understanding of the distinctions between panic attacks, anxiety attacks, and panic disorder. Thanks for watching. Don't forget to like and subscribe to our YouTube channel.